Good evening, everyone. Thank you for joining us tonight. Welcome to the Avexia webinar series. Our topic for tonight is Lab Fundamentals, How to Implement Food Sensitivity and Zonulin Testing in Your Practice. My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your host for this evening. Today, I have the distinct pleasure of being joined by an outstanding guest, Dr. Robert G. Silverman, who will be our presenter for this webinar. Dr. Silverman is a chiropractic doctor, clinical nutritionist, national and international speaker, author of Amazon's #1 bestseller, Inside Out Health, founder and CEO of Westchester Integrative Health Center. He graduated magna cum laude from the University of Bridgeport College of Chiropractic and has a Master's of Science in Human Nutrition. The ACA Sports Council named Dr. Silverman Sports Chiropractor of the Year in 2015. Dr. Silverman is on the advisory board for the Functional Medicine University and is a seasoned health and wellness expert on both the speaking circuits and the media. Dr. Silverman is a thought leader in his field and practice. In addition, he is a frequently published author in peer-reviewed journals and other mainstream publications. Dr. Silverman was the principal investigator on a Level 1 laser FDA study. Joining Dr. Silverman tonight will be Dr. Wayne Sedano, our Director of Clinical Support and Education at Avexia Diagnostics. Additionally, Dr. Sedano is the Director of Integrative Medicine Education for the College of Integrative Medicine and lectures and teaches internationally. Before we begin, just a bit of housekeeping. We encourage participation. So if you have questions, you may submit your questions in the questions field in the right-hand area of the interface. We will answer the submitted questions towards the end of the presentation. If your questions are not answered this evening, you will surely receive an answer by email within a day or two. Without further delay, I will now turn the webinar over to Dr. Silverman.
Thanks so much, Chris, and I'm excited to share the stage with Dr. Sedano. Happy to be here. Something that I do every day in my practice, talking about food sensitivities, leaky gut, zonulin, and the gut's overall effect on people's health. I believe that the gut is the epicenter of your health. And if I could take it a step further, I believe it's the epicenter of your immune health. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. Anything that adversely affects the gut can be overall deleterious to overall health. So I really want to speak about, in some granular details, how food sensitivities can actually damage your gut, how zonulin and what it is affects the tight junctions in your gut. And the big thing is we're overwrought with information. What do? I want to show you how to implement this type of testing into your practice so your patients can benefit and you can reach clinical outcomes with them. I think the biggest thing is that first step and that comfort level, and I'm going to try and bridge that gap in today's webinar. So without any further ado, let's dig in. Alessio Fasano, the doctor, in 2000, he found the protein called zonulin. He said, as an addendum to Hippocrates saying all disease begins in the gut, Alessio Fasano said, all disease begins in the leaky gut. So again, I have some interesting objectives I'd like to share with you. We're going to try and get through these in a very concise manner. Number one, let's understand the value and the benefits of early food sensitivity testing to enhance patient compliance and outcomes. People ask, how successful am I in my practice? How successful am I in that functional medicine model? Well, getting the trust to allow those patients to be compliant is the key to all our outcomes. Number two, I hope everybody's going to be able to learn how to implement food sensitivity and zonulin testing into your practice armamentarium. And three, I hope to explain the roles of different food sensitivities in zonulin in the inflammation cascade. Again, I'm a big believer that our mantra is to manage and modulate inflammation. One of the bigger steps in doing so is being able to ascertain food sensitivities and ascertain if someone has a barrier failure like a leaky gut. And lastly, why and how food sensitivities is without question a baseline marker in chiropractic, naturopathic, medical, and any kind of functional medicine, functional nutrition practices. So before we start, we always have to talk about the problem. So what's the problem? Problem is very simply the American population is unhealthy. 75% of Americans are overweight or obese. 12% of Americans are metabolically healthy. 3% of Americans hit a core 4, and the average American consumes 160 pounds of sugar per year. Sugar is very damaging to people's overall health. Sugar is the most overused over-the-counter drug in America today. When mice were offered sugar versus cocaine, 94% of mice took sugar. When you couple that with an increased consumption of wheat to the tune of about 146 pounds per year, wheat poses an issue. Use an example of wheat, gluten. Gluten means glue in Greek, sticks to your intestinal tract, causes a whole bunch of problems for your main barrier system. If you combine sugar and wheat consumption, most Americans are almost consuming a pound of sugar and wheat combined per day during the year. That's obviously way too much. And when you really think about it, it's all in the carbohydrate macronutrient, which is the one non-essential carbohydrate. Caloric sweeteners. The average American consumes 142 pounds of caloric sweeteners per year. In that, caloric sweeteners increase the incidence of stroke and dementia 2 to 3 times, depending on the data used. There's been a rise in diabetes. What an interesting portmanteau. Dr. Mark Hyman coined the phrase in 2012, diabetes, as there's been a parallel rise between obesity and diabetes. Increasing diabetes increases obesity. Increasing obesity increases diabetes. Pain, joint, and osteoarthritis. As a chiropractor, we all know that 8 out of 10 Americans at some point have lower back pain. I believe that the gut is one of the hidden sources a lot of joint and back pain. Osteoarthritis, unfortunately, is very commonly described as wear and tear. It's truly the next step of evolution of autoimmune conditions, many of which can be stimulated from food sensitivities causing dysbiosis and or a tight junction failure. NSAIDs and medications. NSAIDs, non-steroid anti-inflammatories, Aleve, Advil, ibuprofen. They do decrease pain, but they impair healing. Nutraceuticals, which we'll talk about, decreases pain and promotes healing. Which do you prefer? Medications. We are 4.25% of the world's population here in America. We consume 52% of the world's drugs and 80% of the world's pain medications. So clearly we're a highly medicated country. Toxins and stress. We live in a toxic, stress-filled world now. And lastly, increased neurodegeneration. It has been stated by the year 2030, 1/2 of the US will suffer from some symptomology that's attributed to neurodegeneration. Continuing with the idea of the problem, one of the bigger problems is the overuse and the overexpression of antibiotics. 35 million pounds of antibiotics are produced each year. We, the population, get 80% of our antibiotics through consumption of livestock. That equates to approximately 270 million prescriptions per year in humans. The CDC says conservatively that 30% of antibiotic prescriptions are unnecessary, and over 50% of all hospital patients receive antibiotics. In reference to COVID, 52% of patients received an antibiotic before a positive COVID test. All that being said, antibiotics deplete your immune system because they're nuclear weapons to your microbes. They blow both your good and bad bacteria up. Also losing from the consumption of antibiotics is calcium, magnesium, all your B vitamins, and a critical new vitamin. When I say new, I don't think we give it enough love, if you will, vitamin K. A factoid, 72% of US adults say they have experienced GI symptoms a few times a month or more. 74% of participants have lived with their GI symptoms for more than 6 months. And 56% of those with GI problems have not spoken about it with their primary care physician. To synthesize that and to give a clinical takeaway, about 3/4 of your patients have a gut problem. I ask my patients when they sit down after saying hello, Do you have the guts to be healthy? What have you done for your guts lately? So 5 main causes of autoimmune disease. Number 1, we live in a toxic world, internal and external toxins. Number 2, allergens, and I should really highlight that, food sensitivities, microbes in your microbiome. Is your gut leaky? Is there a dysbiosis? Is LPS being expressed? Your poor diet. The acronym for the American diet is SAD, Standard American Diet. What an intriguing acronym. And lastly, stress, both physical stress to the body and psychological stress. All are typical causes leading you down a path of autoimmune disease. Inflammation. I believe our mantra is to manage and modulate inflammation. Inflammation is the chronic driver of disease, whether it's hidden or silent. It's a problem or a cause of many of the chronic diseases. The takeaway here is very simple. If your gut is not healthy, you are not healthy. So triggers of gut permeability. Now, this is not in any particular order. And believe me, if I put all the things that could trigger gut permeability, we would be stuck on this slide for the duration of the webinar. We've talked a little bit about antibiotics, acid blocking drugs, PPIs. Well, most people think that they have too much acid, but they don't have enough. PPIs lead you down a slippery slope of leaky gut and damage to blood-brain barrier. We covered NSAIDs previously. Heavy metal exposure, environmental toxins, concussion. 60% of people who acquire a concussion have either a leaky gut or a small intestinal bacteria overgrowth. Cesarean birth is not the choice versus a natural vaginal delivery. Liver toxicity. There's a bidirectionality between your gut and your liver. Gut dysbiosis, an unleveling of good and bad bacteria. You need approximately 85.1% good bacteria not to have dysbiosis. And food sensitivities. We'll go into more detail in some of the succeeding slides. However, the takeaway, which I'll repeat several times during the webinar, is the symptomology from a food sensitivity usually occurs up to 72 hours after ingestion of the food. So how can any doctor, how can any patient really know what they're sensitive to without a test? Yeast and bacteria overgrowth also contributes to gut permeability, chronic stress, sleep deprivation, chronic inflammation. Some of the typical or usual suspects: alcohol, gluten, dairy foods, sugar, artificial sweeteners, and also I'm a big proponent to test for food additives and food emulsifiers. So a common additive can truly negatively impact gut bacteria. So these additives are those emulsifiers. They have shown to really drive intestinal inflammation. The effect of the selective food additives on the colon are very precise in that they typically will disrupt the mucosal barrier. They'll cause an ingestion of microorganisms. That all leads to an increase in pro-inflammatory cytokines and an expression of TNF-alpha, ultimately resulting in inflammation. My Dr. Rob's Gut Matrix, a slide that I use in virtually all my talks. I try and surmise everything that the gut, which I believe is, again, the bullseye for health or the epicenter. So look at the gut. Well, what do we mean by when we talk about the gut? Well, gut's comprised of the small intestine, which is a misnomer. It's actually about 22 feet average in most humans. And now new data indicates it varies from 20 to 52 feet in length. They call it small because it has a small diameter, approximately an inch. It is a single layer epithelial cell. That single layer epithelial cell has the thickness of a wet paper towel. However, it covers the surface area, if unraveled, between a tennis and a basketball court. The small intestine's sole purpose is to be semi-permeable enough to allow small digested food particles, water, vitamins and minerals to pass, and on occasion, some bacteria and viruses. However, when it becomes too permeable, leaky, tight junctions open up, things pass that shouldn't pass, get to the bloodstream. It has been stated that the first time the outside world meets the inside world is when something goes through the small intestine into the bloodstream. So when you look at the GI tract, you really want to assess, do you have leaky gut? Do you have yeast or fungal overgrowth? Do you have an unleveling of good and bad bacteria called dysbiosis? You also, again, I like to hang my hat on the idea that I'd like to test for food sensitivities. And you see that little yellow square called LPS, lipopolysaccharide. Gram-negative bacteria are held on the inside of your intestinal wall. LPS holds it there. LPS is an endotoxin. When the gut is leaky, not only is this gram-negative bacteria allowed to go into the bloodstream, but LPS does also, and that endotoxin attaches to specific organs, let's just say the testes and the ovaries, and causes damaging effect to overall structures in the body. Also, as I said before, the gut communicates with the liver. It's bidirectional. 75% of your toxic and chemical overload travels from your gut to your liver through the blood vessels, bloodstream, and 25% moves through the portal vein. So whatever you do to your gut, you do to your liver. Lots of data indicates that when you have a leaky gut, you have an increase in insulin, blood sugar problems, insulin resistant, pre-diabetes and diabetes. When you couple that with the fact that obesity increases with leaky gut, clearly that concept of diabetes comes to mind. It's also been shown in the data that when LPS is expressed, you have 3 times the incidence of heart disease. So now we see a gut to heart axis. There's also a gut to lung axis. There's a gut to skin axis. And chiropractors, there's a gut to musculoskeletal axis. When cytokines are released, they cause an increase in arthritis and joint pain. And when MMPS is released from leaky gut, matrix metalloproteinases, they're the body's own proteolytic enzymes released at the time of injury. They can eat soft tissue and fibrocartilage, i.e. like disc. Now we have not only a gut to joint axis, we have a gut to disc axis. And I didn't want to overlook our gut to autoimmune axis. I had a patient come in today and all her numbers were great on her blood labs except for her thyroid. She's got a gut problem. And maybe the big one, what I call the superhighway to health. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Let's look at the gut to brain axis, which when you have a leaky gut, you have increased inflammatory neurodegeneration. So hopefully this particular PowerPoint will vivify what I just said in that there's healthy cell junctions and there's a healthy microvilli which allow for good absorption. The villi, which are shaggy carpets, they're finger-like projections that are typically there to grab nutrients with their digestive enzymes attached and bring them through the gut wall. Now what you're going to see in this PowerPoint are the white small balls, which are small digested food particles. Because the gut is in pristine condition, it's the only thing that's allowed to pass, whereas the big blue balls, which are undigested large food particles, get sent to the large intestine to be eliminated out. Now, when you have the converse, you have damaged cell junctions and tight junctions become loose junctions, and you have damaged villi with poor absorption, you see both small and large food particles pass the gut lining. When those large particles, which are proteins, pass the gut lining, your immune system signifies them and begins a signaling agent that could ultimately lead to localized inflammation, systemic inflammation, with all in an end result of autoimmunity. Dr. Fasano once said that the gut is not Vegas. What happens in the gut doesn't stay in the gut. The gut-brain connection, interesting, getting to the root cause of the broken brain. Remember, the gut has 400 times the amount of messages from the gut to the brain than the brain to the rest of the body. There's over 1,000 species in the gut. The gut has about 3 pounds of bacteria, trillions of bacteria in the gut. 20 million bacteria genes as compared to 2,000 genes in humans. Obviously, there's more bacteria than cells in your body, and the gut has more neurotransmitters than the brain. As a matter of fact, 93 to 95% of your serotonin comes from your gut. As I probably just said before, gut on fire means brain on fire. That leads to intestinal inflammation. So when the gut is on fire and the brain is on fire, there are no symptoms of pain since the brain has no pain receptors and the inner lining of the GI mucosa has no pain fibers. When the pain and gut are on fire or inflamed, the typical symptoms are bloating, followed immediately by brain fog. Inflammation of the brain's neurons in the brain does not cause pain, instead reduces nerve conduction. Lastly, This reduced nerve conduction results in slowed nerve transmission that is typically described as brain fog. So let's take it to the next step. Let's compare on the left and the right side. Left side, perfect, in place, tight junctions. Right side, leaky and inflamed. Toxins pass through. They burrow their way through the mucosal membrane cells. They get into the bloodstream. And in the bloodstream, you have IgG, IgA, B and T cell immune response, leading you down a path and resulting into nutrient malabsorption, autoimmunity, food sensitivities, blood-brain barrier breach, and systemic inflammation. Well, we can look at some of the things that we mentioned before, like stress, the gut microbial composition, toxic chemicals, medications, inflammatory cytokines, undigested food particles, lectins and agglutins, food colorings, and gums. We all know what gum does because we've all swallowed it. Leads to intestinal barrier dysfunction, ultimately food allergy, intolerance, and of course, food sensitivities, immune system abnormalities leading to autoimmunity and influence on the blood-brain barrier in neuroautoimmunity. We talk about neurodegenerative diseases so much and we don't realize, or sometimes it's overlooked in the discussion, the impact that the gut makes on those neurodegenerative diseases. Here we're seeing a compromised gut allowing LPS to go through and also allowing amyloids to go through. Amyloids cause systemic inflammation. They can compromise the blood-brain barrier. When they get into the blood-brain barrier, the next step is into the brain. The blood-brain barrier is the doorway to the brain, compromising the central nervous system components. So when you hear about all the drugs that block the amyloid, that's all well and good. But what is the root cause of amyloid production? It appears, certainly in this article, that amyloids are coming from the gut. So root cause resolution is not the disease. It's what causes the disease. So as we adhere to these functional nutrition, functional medicine tenets, we need to understand that we want to get to the root cause. The end result is not the root cause. Taking it one more step, the gut in Parkinson's disease is a bidirectional pathway. The gut epithelium is a multifunctional interface. So here's another very common and unfortunate neurodegenerative disease. The role of the gut microbiome in autism. The gut microbiota is associated with autism. It alters immune system and metabolism. You have a higher intestinal permeability with a higher antigenic load from the gastrointestinal tract. LPS is increased in autism. You have a less diverse, and the more diversity is required. You want true biodiversity in your gut. The more biodiversity in your gut, the better options you have versus autism. Candida has been shown to be twice as abundant in autistic patients. And here's a huge clinical gem. Up to 90% of people with autism suffer from gut problems. So arthritis actually has a susceptibility to the gut microbiome, in that something like a rheumatoid arthritis is a multifactorial disease that involves both genetic and environmental factors. Among its generic factors, HLA alleles provide the strongest risk, while among environmental factors, smoking infections are also involved. A role of hormones and changes in immune system during aging are also associated with the pathogenesis of RA. All the factors that influence RA also impact the gut microbial composition. Gut microbiome provides a link between all the factors that influence RA. An individual may harbor a core gut microbiome, and certain species may contract or expand depending on the exposure to various environmental factors, thus influencing the immune system locally in the gut as well as the adaptive immune system. So here we have a wonderful cascade of inflammation and obesity, gut dysbiosis, leading to increased intestinal permeability, ultimately leading to osteoarthritis. Whereas if you add physical activity, diet, and good quality probiotics, you should have a positive influence on it all. You want to avoid the decrease in gut biodiversity, the decrease in tight junction integrity, and the increase in cytokines, LPS, and matrix metalloproteinases. or taking it from another vantage point. Altered microbiome and the release of cytokines lead to an invasion of intestinal cells. There's a transcellular breakdown of the intestinal barrier, bacterial toxin translation or translocation leading to systemic inflammation, ultimately to extraintestinal autoimmune reactivity. People ask me all the time, the gut's leaky, something gets through, which is typically a protein, bacteria, or virus. What's this theme of molecular mimicry? The idea of molecular mimicry is quite simple. The molecule mimics another molecule. Essentially, every molecule has a protein sequence. Many foods have protein sequences that are very close to structures on your body. A great example would be dairy and gluten, which mimic in their sequence very closely the cerebellum. So when your immune system isn't functioning well, whether it's overrun or it's understaffed, if you will, it gets confused with the presenting antigen or molecule, and that molecule looks like something else, and your body begins to attack everything that's similar to the molecule. So the takeaway here is gluten and dairy, believe it or not, when expressed, typically mimic the needed attack to the cerebellum. So what are some other examples of autoimmune diseases? Rheumatoid, lupus, IBD, multiple sclerosis, type 1 diabetes, psoriasis, Graves' disease, osteoarthritis, Alzheimer's, and post-brain injury. So my definition of autoimmune is when the immune system makes a mistake and attacks the body's own tissues or organs. Let's take one step further. What's my take on food sensitivities and food sensitivities' effect on health? Number one, food sensitivities will lead you to a systemic inflammatory response. You'll see a lot of skin reactions. We overlook skin reactions. They are a critical part of our immune system response. Food sensitivities can lead to joint pain, muscle pain, and tightness. They can simply lead to GI symptoms. Food sensitivities can give you brain fog, anxiety, depression, mood swings, neurodegeneration, autoimmune issues, both body and brain fatigue, and lead you down a path of body composition issues. So let's run this overview of food sensitivities. There's a growing number of prevalence of food sensitivities driven by the quality of food in the food chain and incredible amounts of processed foods being consumed by the American population. Food sensitivities or related diseases affect 100 million people worldwide. I believe that number is vastly underrated. The prevalence of food sensitivities has increased by 50% in adults and 70% in children over the past few years. Symptoms vary. You'll see a full array of all symptoms from musculoskeletal to skin to more organic. 90% of sensitivities are in these 8 food groups, probably no surprise to anybody. Milk, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish. Delayed food sensitivities occur hours or days, 72 hours after food ingestion. Again, that's the beeping red light. Delayed food sensitivities are typically caused by IgG 1 through 4. Everybody knows that IgG is a critical antibody. Most companies test for IgG 1 and 2. That is not sufficient. By testing for IgG 1, 2, 3, and 4, you're running, with no pun intended, the full complement. IgG 3 is 7% of the IgGs, but it is a stimulation of the complement inflammatory system. So you want to test for IgG 1 through 4 and immune complexes that activate that complement. When you're looking at IgG or any kind of antibodies, you're looking at the adaptive immune system. When you're looking at the immune complement, you're looking at the innate immune system. Now you're looking at a food sensitivity that's stimulating both the innate and the adaptive immune system as confirmatory inflammation from eating that food. So when you break down food sensitivities from food allergies are one, IgG, they're delayed reactions. The response is not fast. The bottom line is if you have a food allergy, you'll know. Red, swelling, increased heart rate, etc. Food sensitivities will create an inflammatory cascade. You need to blood test and test that food protein. Inflammatory responses sometimes are slow, so people may have more than one food sensitivity. A lot of times it's very hard to determine which food is the culprit. So I'm a big proponent on putting my detective hat on and getting my Sherlock Holmes magnifying glass and looking to do what? Remove. Remove what? Specific triggers. Remove triggers like proteins, infections, toxins, chemicals, and pathogens. I also want to try and repair the barriers like the blood-brain barrier, the skin barrier, and of course, the gut barrier. And lastly, I want to harmonize to allow the body to communicate. The body is an interconnected organism. If I could, I always like to say I want the body to sound like a mellifluous sounding soliloquy, not a bunch of people trying to play in an orchestra without a conductor. So the FIT test, why practitioners should use it. The FIT test, the food inflammation test made by KBMO, is very simple because it tests for food sensitivities, inflammation, and gut permeability all in one test. So immune complex issues and inflammation can be associated with foods. I believe it's one of the biggest underlying problems for all the conditions I see in my nutrition, functional medicine, and chiropractic practice daily. So when do providers use the food inflammation or the FIT test? Well, one, patients are struggling to lose weight. If you feel or they have an autoimmune disease, migraines, surprisingly enough, a lot of foods will generate the migraine. The patient has a thyroid problem, arthritis, brain fog, fatigue, and clearly if the patient has digestive, gut, and skin problems. So what are the top, according to the FIT test, top 20 foods that are positive for food sensitivities? Number one, almonds, bananas. These are in alphabetical order. Beef, brewer's yeast, candida, casein, chicken, corn, cow's milk, egg whites, egg yolk, gluten, peanut, pineapple, salmon, shrimp, soybean, tomato, white potato, and whole wheat. So let's look at a FIT test client report. Here is a colorful, and I would like to underline the word colorful. This is what you get back. And this is great because one, it does lead the practitioner through the results. They're easy. The red is the big color, obviously red. It would be considered a number 4. Orange would be a number 3. Yellow a number 2. And the light lime green number 1. The green, there's almost no response. You don't worry about those. I worry about everything 1 through 4. I like to take for the first test everything out. Now, what's great about the client report is not only is it easy for the doctor, it's very evocative for the patient because they see the colors and it really resonates with them. And what also they test for are specific food additives. And there you see your aspartame, your polysorbate 80, your saccharin, etc. I can tell you that 1% of polysorbate 80, even less than that, anything in polysorbate 80 immediately makes anything organic inorganic according to a food label. Continue with the FIT test, you're also taking a look. Now they're testing the leaky gut. And one of the things they're looking for, if you see the big arrow, that's candida. So the real question is, why is KBMO worried about chemical additives? I think they're wise in that they realize that these chemical additives have an adverse effect on the gut barrier or the gut microbiota. This particular slide, this immune complex formation, we could spend, again, it's one of those slides that we could just delve into and spend a lot of time. I really just want to share the highlights. Number one, look at the lamina propria on the right versus the lamina propria on the left. So what do you see? A much smaller broken up lamina propria. So if you've got a leaky gut, and this depicts obviously food additives and foods enter the gut going through in this inflammatory cascade, ultimately stimulating immune complexes. You can get cytokines, killer T cells, and antibodies producing an autoimmune process at the intestinal level. So if you've got autoimmunity in your fingers, if you've got it on your skin, if you've got it in your brain, you've also got it in your gut. Now, I can tell you that the data indicates if you have autoimmunity at the gut level, that's a 1 to 2 year process. And I can also share with you, if you're not an experienced, comfortable practitioner, that's hard to share with your patients. Lastly, what you want to look at is immune complexes. In the immune complexes, you want to see that the immune complexes deposit in the tissues, complement is activated, inflammation, and symptoms. So I don't want to go into crazy detail on this particular slide. I believe that this slide is an excellent adjunct to the previous slide in that you really see the idea of an enhanced conjugate and two signals. So here you're seeing left and right, the comparison of conventional conjugate single pathway with enhanced conjugate. Basically, what I'm trying to say is that the fit test tests for the dual pathway. So many providers ask, why providers use it? What do I mean by this dual pathway? I didn't feel that you explained that well, Rob. I need a little more info. Great, here it is. Acquired immunity. We all know that's the second half of our immune system. That measures the antibodies, I said before, IgG 1 through 4. Also looking at immune complexes. The innate immunity measures complement C3d. That measures inflammation. Therefore, immune complexes that cause inflammation are an underlying problem for many conditions seen on a day-to-day basis. You're testing with the FIT test. Food sensitivities, innate immunity, and acquired immunity. So you're getting that dual pathway to have a high level of accuracy. Defective barriers are linked to a myriad of chronic diseases. The bottom line is epithelial damage to the skin and the mucosal barriers lead to specific food sensitivities. So why test for increased intestinal permeability? People ask me all the time, hey, Rob, everybody's got leaky gut, don't they? Well, not necessarily. Not everybody has leaky gut. And if they do they have gut dysbiosis? Do they have tight junction problems? Is LPS expressed? What do you have at the gut level? I mean, let's qualify and quantify. Chiros love to take x-rays, MRIs. Orthopedists love to take MRIs. Primary care physicians love to take blood. We want to use these as a baseline. So everybody doesn't have it, but you want to know what they have and what their status is, because testing really reduces the incidence of overtreatment. So why are you going to test for increased intestinal permeability? Well, patient compliance goes up when you assess, treat, and reassess. Sometimes symptomologies are behind the body's healing process. And people say, I still have gas and bloating. I'm done. You didn't do your job. Yet when you show them a before and after test, again, it becomes very revealing and allows the patient to be a little bit more compliant. So let's dig into zonulin. For me, zonulin is extremely exciting in that zonulin is a protein that opens at tight junctions. Zonulin typically, or main triggers of zonulin release are gliadin and intestinal bacteria. Take a good look at this. Zonulin and an anti-zonulin antibody. What KBMO with their FIT test does that's very unique is test for an anti-zonulin antibody. So they're testing for zonulin, but they're testing for the specific antibody to zonulin. Zonulin expression shows that there's pressure. I'm going to turn on my... Hey, everybody. Here's your gut. Here's your joint. Zonulin, let me get closer, pulls and pulls and pulls. The pressure, I'll go like this, the pressure of the pulling is zonulin. The breaking expresses occludin, and that's coming out in October. So let's take an overview of zonulin. Interestingly enough, the protein that is synthesized in the intestinal and liver cells, it's a key biomarker for intestinal permeability, only reversible regulator of intestinal permeability. Elevated levels of zonulin lead with autoimmune disease, adult glucose intolerance, celiac disease, inflammatory bowel, non-celiac gluten sensitivity, obesity, RA, multiple sclerosis, type 1 diabetes, and non-alcoholic fatty liver. And I want to go through these real quick. I want to pick up the pace. I want to get to the end. I want to answer any questions that everybody has. I want to bring on our other doctor who's got some great treats to share with us. I always like to say that at the end, when I work with Dr. Wayne, we're going to have some snackable key takeaways. So with COVID, and one, the virus gets shedded through the gut, inflammation will promote excessive gut permeabilities. So there's an increase in tight junction permeability in severe COVID. What you'll see is an incredible increase in zonulin release. Zonulin is a marker for higher mortality in severe COVID-19. So SARS-CoV-2 in the GI tract, epithelial expresses zonulin. Failure of the tight junctions, increased intestinal permeability. SARS-CoV-2 lead to systemic circulation and hyperinflammation. So problems with zonulin protein measurements in ELISA testing. Well, here's the problem. A lot of companies have a cross-reactivity because they test for haptoglobin, propridin, complement fragments, blocking zonulin binding, resulting in very low positive rates. The sample timing, the concentration in serum varies widely during the day. So you want to it's very difficult to get an accurate measurement. Serum is much more accurate than the poop. In addition, zonulin IgG antibodies measurement resolve problems with zonulin protein ELISA. It eliminates the cross-reactivity. It has a proper positivity rate. The sample timing is stable, so assuring accurate measurements. And as I said before, blood serums are extremely accurate, but so is blood spots. There was a new study that just came out a few months ago that talked about the statistical equal in outcomes of a blood spot to a serum. So many of us don't have access to blood spots in our office. I use blood spots, finger pricks, whatever you want to call it, religiously in my office. I found them to be extremely effective, and the data now backs that up. So the FIT test, an overview, measures 176 foods, colorings, additives, and zonulin. Fingerstick enables quick and easy way to obtain sample. The multi-pathway detection technology is ensuring that it's IgG 1 through 4 and complement. The complement generates inflammation, so you are testing for C3d, and you're testing for the anti-zonulin antibody, a true marker of gut permeability. So higher levels of zonulin actually have shown to be obviously adverse, but higher levels of zonulin are associated with a higher waist circumference, blood pressure, fasting glucose, and an increased risk of metabolic disease. In office, so I've got what we call the FAST test. Two examples of a FAST test, really easy. You're testing for eggs, milk, and wheat versus control. So I use that all the time. People say, I'm not sensitive to any foods, this and that, bang, real fast, go for it. Clinical studies, let's get into some clinical studies with the FIT test. So basically they tested before the elimination diet and after the elimination diet. And you see a precipitous drop in the number of sensitivities reported after the elimination diet with 30 patients, indicating the FIT test could predict specific food sensitivities. Taking it a step further, breaking down the clinical testing results, you see a significant improvement in symptoms observed after the elimination diet. I mean, dramatic drop in mood, memory, anxiety, mood, bloating, stomach pain, fatigue, sleeplessness, joint pain, stiffness, swelling, etc. So there was a study done with irritable bowel syndrome. The occurrence is irritable bowel syndrome happens to about 18% of North Americans. Medical care, 25% seek primary or secondary care for symptoms, and 5% seek tertiary care settings. The cost, really sizable for physician visits, emergency room visits, diagnostic tests, and pharmacological treatments. So Dr. Isefi did this particular test on evaluating the health benefits and outcomes of IBS. So essentially, the results were stellar. Here was IBS score from day 1 to the end of the study. abdominal pain and days, bloating, and bowel habits, the intervention group did have a decrease, a dramatic decrease, 3 times the decrease that the control group had. Homocysteine, your stroke marker, the intervention group had a decrease, while the control group had this dramatic increase the whole way. And C-reactive protein, tissue inflammation, the intervention group decreased 5 times what the control group does. You know, sometimes numbers speak for themselves, and the interpretation of numbers says symptom severity, homocysteine, and tissue inflammation all decreased by taking out foods that your patients are sensitive to. Hospital stays and visits had a 10% reduction, and visits to the specialist and PCP were decreased by 50%. So what does it all mean in a nutshell? Where's the clinical takeaway? Well, clinical outcomes in IBS greatly improved when using the FIT test. FIT test resulted in twice the IBS severity score reduction compared with cellular test. The FIT test resulted in a 50% improvement in IBS severity score compared with tests that measure only IgG only. The conclusion, clinical outcomes for IBS greatly improved when using FIT test to predict food sensitivities. So, food sensitivities, very effective for predicting food, the FIT test, very accurate for predicting food sensitivities, great when you apply it in the setting of somebody that has irritable bowel syndrome. So, my KBMO FIT test conclusions. 1, you're testing for dual pathway detection technology, IgG and complement. 2, complement generates inflammation, test for C3d. 3, the big takeaway, anti-zonulin antibody is a marker of gut permeability. And 4, excellent clinical outcomes backed by an RRB approved clinical study. I do believe we all live in a gut busting world. So what's my suggestion? Well, I think I'm going to use this slide, everybody, as the one slide, and I won't get into granular details, but here's what I would recommend, my 7R action plan. Number 1, reset. Reset what? Reset your diet. Take the carbohydrates out. Take the food sensitivities out. Start eating a better quality fat, protein, and minimize any added sugar or sugars. Exercise. When I'm done with this, I've been going since 6 o'clock this morning. I'm going to go downstairs and work out for an hour. That's just my commitment to the lifestyle. There's other work to be done. Mindset. You know, how many of us have to work with patients and, you know, they're a little negative. They just do not see that flickering light at the end of the tunnel. They've got to understand that health is wealth. So you want to reset their diet. Diet is not a jail term. You want to give them a health promoting lifestyle, get them moving a little bit, and have them a good mindset, maybe meditate, whatever makes them happy. Remove. This is one of the biggest R's. You want to remove what? You want to remove your unwanted pathogens. You're going to remove things from your diet like food sensitivities, food allergies, food intolerances. And how are you going to remove your unwanted pathogens? Number 1, I combine detoxification at the same time as my gut protocol. So you'll do some detoxification, trying to bifunctionally modulate the liver to remove toxins. 2, you want to take those pathogens, those bacteria, viruses, and fungi that you don't want there. You'll do so by using oregano oil. Oregano oil emulsified is a beautiful herb to help with the upper airway release of pathogens. Berberine is a great choice. It's for the dysbiotic, the train wreck patient. It's great for the bowel. Berberine affects multiple pathways, especially the AMPK pathway. Garlic is your natural antibiotic, natural antifungal, antiparasitic, and maybe the secret sauce of it all, serum bovine immunoglobulin, which is the mop of the gut. Replace. What are you going to replace? Well, you're going to replace needed digestive enzymes, stomach acid, and bile, because 60 to 70% in most studies have shown that Americans have a digestion problem. So again, digestive enzymes, pancreatic enzymes, stomach acid, and increased bile flow. You want to regenerate as your 4th R, your damaged intestinal mucosa. You're going to use a plethora of different nutrients to allow for a decrease in inflammation, or if you will, have an anti-inflammatory effect inside the gut. And you're also going to heal and seal that gut lining. Glutamine, aloe vera, glucosamine, zinc carnosine, a secret gem in that zinc carnosine is great for tight junction problems, alpha lipoic acid, omega-3 fatty acids, vitamin D, no surprise. The fifth R is going to be reinoculate. Reinoculate with what? Reinoculate with your pre and probiotics. The prebiotics, the fiber, the food to feed the probiotics may be more important than the actual probiotic. So pre and probiotics will actually lead to what we call a postbiotic. A great postbiotic would be a short chain fatty acid like butyrate. So we want to reset, we want to remove, we want to replace, we want to regenerate, we want to reinoculate, so we can reintroduce and retest with certain foods that were removed. So for instance, say you're food sensitive to broccoli and Brussels sprouts, some cruciferous vegetables. You can reintroduce them, you can reintroduce through a test, or you can reintroduce a food at a time for 3 days, because obviously we know a 72-hour lag from ingestion to symptomology. I usually test, treat, and retest. You want to be able to give them back some foods that you took away. I can tell you this for 23 years of practice. If you take something away or many things away and you don't give them back something, they will probably leave you because patients want options. And lastly, you want to retain your health, retain your GI integrity. You're going to do so by adhering to a good diet, a healthy lifestyle, a good mindset, and probably taking a good quality multivitamin, multimineral with phytonutrients, omega-3 fatty acids from 2 to 4 grams, vitamin D3 with K2. And in that K2, well, in the D3, you want about 5,000 IUs. In that K2, you want the MK7 trans form of the K2. You want a good quality probiotics, and you always want to switch them to get your biodiversity. And probably the fifth one, you would be best suited taking a dynamic fruits and greens drink. So we kind of went through these. I want to save this. You guys will get a copy. In the interest of time, I want to get to this particular slide because I want to bring our stellar doc on. I want to answer any questions you have. The most effective clinical outcome across all disease spectrums can result from the normalization of gut function. And lastly, which came for? How to implement food sensitivities in zonulin testing. Number one, patients will present with complaints, gas and bloating, digestion problem, brain fog, joint issues, gaining weight, infertility. A subjective questionnaire really goes a long way to help the doctor identify underlying issues. After that subjective questionnaire, when the patient comes in, you may want to, at that point, and this is what I recommend, do a food sensitivity and a zonulin testing. Occludin is coming in August. You'll then want to review the test findings, go through them from soup to nuts, if you will. You want to have protocols and apps to enable the doctors to make confident recommendations. I shared you some protocols for the gut. KBMO has a great app. You then want to retest and then reintroduce some of the new foods to show that you had a positive outcome. As Sir Oliver Wendell Holmes once said, the mind once stretched by a new idea never returns to its original dimensions. My goal is for everybody in this 60 minutes to have stretch marks. So if anybody has any questions, please feel free to reach out.
So I think we're going to take questions now, if that's okay with you, and get Dr. Sedano's take on your presentation. Doctor, what do you think?
Well, it's fantastic, and Dr. Rob Silverman, thank you so much. I've seen you lecture before, and it's always an honor to have you there. You hit all the high spots, so I want to thank you.
Thanks for
Awesome.
having me, and it's a pleasure to work with somebody who's a pillar in the functional medicine chiropractic world like yourself.
Great. So now we'll move to some questions. Blair Grant early in the presentation asked, when would you consider retesting this, or is this even something you would do? So I don't know if you want to answer that. I know that you kind of touched on that a bit.
Sure. No, I think it's a great question. I think timing is key. I usually wait 3 months, a minimum. You know, again, it's on patient compliance. If they've been on the program and really adhered to about 90% of the program, 3 months is ample. So you're looking at a 3 to 6 month period within the food sensitivities. For dysbiosis, it's about 3 months. For tight junctions, and I know this isn't what everybody wants to hear, it's about 9 months. And let's not even go down the path of autoimmunity at the gut level.
Okay. Asia Real asks 3 questions, but I'll start with number 1. How helpful do you think an FMT at the Taymont Clinic could be for those with chronic digestive issues that haven't improved after years of functional medicine protocols?
I think FMT has its place. I don't know about the particular clinic because I'm not trying to push any clinic. I think that without question, they have their place. I think that we've got a sufficient amount of tests to choose from. And I think that the ability to choose the right test at the right time is a critical decision that we make. And I think that's something at that point, if someone hasn't responded well, you may want to do.
Okay, great. The second question is, where does IgA, secretory IgA, and IgM play a role in looking for food sensitivities?
I think they do play a role. I think IgA, as everybody knows, is secretory, as you said, is at the gut and the lung lining. Some companies do IgM because they show early. I like the idea of IgG because that is the, 75% of your antibodies are IgG. It's the smallest antibody. It passes through the placenta to the fetus. It's the most protective. And when you consider that that is KBMO using IgG 1 through 4, I think you really got a good marker within the adaptive immune system. I don't think any of the other markers are useless at all. I'm just happy that they're going with the IgG and the 1 through 4.
Great.
You
And
can,
then,
just jump in here real quick. I know with the secretory IgA and looking at IgA, that a lot of the some tests will consider that looking at the mucosal immunity on that. With doing zonulin, which I think should be done on every test, in my opinion, especially this the antibody, which is fantastic. I think you're kind of covering your bases of what's going on with the intestinal lining.
Great ad. Thank you.
third question is, KBMO offers so many tests. How do I choose? And then I open up to both doctors.
Well, I mean, I think there's 3 tests. I think you have the 132, I think you have the 22, and you have the 176. You have the fast test. I just keep the fast test in the office so somebody could see something really quick. Out of those 3, I almost always happen to do the 176, and on rare occasions it'll be 132. But now the 176 comes with the candida. It comes with the zonulin, an accurate test of the zonulin. Understanding that we are, as Dr. Wayne said, not only testing for zonulin, we're testing for the antibody to zonulin. And when you get occluded in there, which will imply the tearing of actual physical tight junctions next month, I think you're really having a trifecta. So I would go for the 176 with the leaky gut test.
Okay, and our well, last question as of right now. Again, Blair Grant with, once it shows that someone has a food sensitivity and they stick with the protocols and then retest to find that they are no longer sensitive, is it safe for them to reintroduce, or is it something they should always minimize in their diet?
For me, it's safe to introduce. And my take on food sensitivities, and this is a great conversation at the dinner table. To me, food sensitivities are a sign that there's a digestion problem and or there's a leaky gut. So if we can fix the digestion and we can fix the leaky gut, in theory, we can fix the food sensitivity test. So I don't know if I would, if they took away again broccoli and Brussels sprouts, if I eat pounds of it, but I certainly would put it in my diet.
Great. Well, thank you for those wonderful answers. Hopefully everyone appreciates it. And if you have any other questions, I will provide an email later that you can send to us, and then we can get you some answers. Doctor, would you proceed to the next slide, please? Well, right now we're going to introduce a few features of Avexia Diagnostics that we have. One is the Ask the Doctor service. It's a free service available to all of our clients with Dr. Sedano. He will review your test results or clinical conditions, etc., via an email system. He gets back to you very quickly, though. And there's also an online video conferencing session that you can schedule for an additional fee. Doctor, do you have anything to add about that?
No, like you said, the questions will get answered usually that day. I can pretty much guarantee that because I know how important it is to everyone. Had a lot of success with this Ask the Doctor, so please avail yourself of it.
Yeah, it's a great service. Doctor, would you proceed to the next slide, please? And because of this wonderful presentation, KBMO and Avexia Diagnostics is offering this wonderful first-time offer with a reduced price on Fit 132 and 176, as you can see here, basically $100 off, and that will be applied at the end of the month if you're new and you've never ordered the test before, to try it out, hopefully to help your patients. So obviously we welcome you to take advantage of that.
If you don't have a patient, try it out on yourself. Take advantage of this. I've done
a good idea.
Members of patients, so I would certainly give it a try.
Excellent. Could you proceed to the next slide, Doctor? Thank you. Now that we've learned about food sensitivities, Zonulin, and the FIT test, I would like to review how to order the test before concluding the webinar. As you can see here, we've got, first you will need to log into your Avexia account and go to the Avexia link ordering banner via the quick links located on the left-hand column of the dashboard once you've logged in. Next, you must select or create a patient to assign the test to. Then select Specialty Labs and go to the KBMO Products tab. Then you would locate the fit test of your choice, and finally complete the test ordering by clicking the green Place Order button. It's just that simple. Doctor, if you don't mind proceeding to the next slide.
Sure.
Here, for any questions or issues you may have, contact Avexia Diagnostics by email at info@avexiadiagnostics.com. That's what I was talking about if you have any more questions, or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Silverman and Dr. Sedano, for this informative presentation. A recording of this webinar will be available by email in the next few days. Thank you again for joining us. Until next time, from everyone at Avexia Diagnostics and KBMO, stay healthy, stay safe, and we wish you all the best on your pathway to wellness. Thank you, everyone.
Thanks, Chris. Have a good night, Dr. Silverman. A pleasure. Thank you.
Now.
Okay. Bye-bye now.